If you struggle with chronic itchy skin, don't scratch, don't rub, and definitely don't overwash because your skin might be fighting an invisible war. If your itching is so intense you can't sleep, your skin is extremely dry with symmetrical red patches, oozing, crusting, and flaking, especially worse during seasonal changes or stress, type eczema in the comments. This could be atopic dermatitis. As one of the most burdensome non-fatal skin conditions, over 31 million Americans suffer from it and cases are rising. We have to ask, this condition once broadly called eczema, why does it keep coming back? Why does it itch more when you scratch? Is it contagious? Can it be cured? In this video, dermatologist Dr. Joe will explain the truth about atopic dermatitis. Atopic dermatitis, or AD for short. Now, for our smart viewers, we're not talking about advertisements here. First, just how bad can AD itching get? One patient described it this way. Since it started, I haven't slept through a single night. When the itching gets really bad, my whole family has to help me scratch. Even when I'm bleeding, it still itches. It's heartbreaking. So why is it so itchy? The exact mechanism of AD can be summed up in 3 words. We don't know. But not knowing doesn't mean we know nothing. Let's talk about what we do understand. Atopic dermatitis is a common chronic inflammatory skin disease linked to genetics and allergies. Research shows AD is associated with family history, immune dysfunction, skin barrier defects, environmental and psychological factors. Regarding genetics, having parents or family members with allergic asthma or hay fever is the strongest risk factor for AD. Research has found certain gene mutations may increase AD susceptibility, like filaggrin. Think of your skin as a protective wall, and filaggrin is like the cement between bricks. When the cement is weak, your skin barrier becomes leaky, moisture escapes, leaving it dry and fragile. This lets environmental irritants like microbes and allergens easily invade the epidermis. AD patients show various immune abnormalities, particularly activated Th2 cells. These activated Th2 cells and basophils secrete interleukin-4 and interleukin-1-3, key cytokines driving AD, triggering inflammatory cascades. I know most of you are lost here. Just remember the immune system goes haywire and overreacts. The inflammatory mediators released stimulate nerve endings, creating that maddening itch. So you can't help but scratch. But this scratching further damages your already fragile barrier, triggering even stronger immune responses. It's like having a small fire and trying to put it out with gasoline. The problem is this itch is nearly impossible to resist, especially at night when you're trying to relax. Your fingers automatically reach for those itchy spots, creating a vicious cycle. The more you scratch, the more it itches. Environmental factors include climate changes, lifestyle changes, improper bathing habits, infections, and environmental irritants. Psychological factors like stress, anxiety, and depression also play important roles in AD flare-ups. To sum it up in one sentence, currently, AD's mechanisms are complex and specific triggers vary from person to person. It's all not entirely clear yet. That's our conclusion. As the manga Blackjack once said, for someone involved with the most advanced modern medicine, it's shameful to dismiss things with, "We can't explain it." But this serves as a reminder that modern science isn't fully mature yet. It's not all-powerful. This humility is necessary. Even though we haven't fully figured out AD's exact mechanisms, through proper management and treatment, we can control symptoms well and reduce flare-ups. So how should we manage AD? First is lifestyle modification, including proper bathing, skin moisturizing, environmental improvements, and avoiding allergens. We've created infographics for this. Feel free to screenshot and save. Additionally, the 2025 clinical guidelines outline various topical treatment options like topical corticosteroids, topical calcineurin inhibitors, and JAK inhibitor creams. Topical corticosteroids are like fire extinguishers, quickly putting out inflammation, reducing redness and swelling, and relieving itch. They're first-line therapy for AD, but long-term use can cause side effects like skin thinning, darkening, and visible blood vessels. So always follow your doctor's instructions. Don't overuse them. Topical calcineurin inhibitors work like a leash. They inhibit calcineurin activity, preventing T-cell activation. thus suppressing AD's immune response, achieving therapeutic effects. In plain English, they temporarily restrain your overactive immune system. Recently, a new class of topical treatment emerged: aryl hydrocarbon receptor modulators. Think of the aryl hydrocarbon receptor as a command center. It senses environmental changes and regulates immune responses and inflammatory reactions. These receptor modulators reduce type 2 inflammatory cytokines, decreasing inflammation while promoting skin barrier repair. Currently in the US, it's approved for mild to moderate AD in patients 2 years and older, offering AD patients a new option. For more severe cases, there are biologics and immunosuppressants as systemic treatments. Here is what's important to emphasize. While AD's mechanisms aren't fully clear, current medical approaches can achieve long-term remission and reduce flare-ups through various treatments. As an AD patient, don't lose hope. If symptoms are severe, seek medical care. Don't delay. We've created charts of commonly used AD diagnostic criteria for your reference. But we must emphasize, AD's skin appearance looks similar to many other skin conditions, but treatments are completely different. AD presentations can also be atypical. So even if you match these diagnostic criteria, we don't recommend self-treatment. Always consult a doctor before using medications to avoid misdiagnosis and worsening symptoms. In this war, your skin is waging against no enemy. Even though the exact cause isn't fully understood, we're not fighting alone. Every medical advance brings better treatment strategies for this battle. I hope this information becomes armor for your skin. And next time we talk about AD, I hope to see good news from you in the comments. Alright, that's all for this video. If you found this helpful or learned something new, please subscribe so you can learn more about health and medicine.